So welcome to this episode of Menopause Conversations. I'm delighted to have a guest with me today who I've been watching quietly on Instagram. So I'd like you to give a warm welcome to my guest this morning, Dr. Sam Brown. Hi Sam, how are you?
Hello, very well, thank you.
Great. And you'll see that she's from the Bronte Clinic. So what is the Bronte Clinic? Tell us a little about you and what the Bronte Clinic is.
So yeah, I'm Sam Brown. I'm a GP. I've been a doctor for over 20 years now and a GP for most of those. I did my advanced certificate in menopause care in the last few years with the British Menopause Society. So now I work at the Bronte Clinic, which is a clinic up in Chelsea specialising in women's health. So I do all things menopause. We also do wellness checks. I have a colleague who's great at PMDD and sleep disorders. We also offer contraception, so coils and implants, which I think women are really struggling to get done sometimes in the NHS, depending where they live. And my colleague, Dr. Fiona McCarthy, does aesthetics. And the Bronte Clinic, we were just having a quick chat, weren't we? We loved the Bronte sisters, and the name and their quotes and the women they were seemed to fit with kind of what we were trying to do at the clinic, which is to empower women to be the best versions of themselves, to feel themselves and to feel well.
Yeah, that's absolutely fantastic. And that's something I'm equally passionate about, helping people be the best version of themselves, particularly women, because that's so important. But if I read just some of the values, please, everybody, check out the website. It's absolutely beautiful. And it's a very warm, inviting. It's probably one of the nicest websites I've seen, certainly in the menopause space. So I'd really encourage you to have a look. So, but you talk about the values of the Bronte sisters, which I think is like the epitome of girl power back then, which is female unity, determination, dissatisfaction with mediocrity, and challenging the status quo. I mean, that's so refreshing to see. And that's what you're enabling women to do through the services that you just described, which is wonderful. So how come the Bronte Clinic and how come now? I mean, what was the catalyst for you to do this?
Yeah, so I was a GP partner for many years. I left in 2019, and the plan was to work a little bit closer to home because I had a massive commute, and to develop my interest in the menopause. And then COVID hit, and it kind of took a back burner for 2020. And then this time last year, had a chat with Fiona, who I've known for 20 years. And we came up with the idea of the clinic. So that was why now. And the menopause, I think, I've always had an interest in women's health. So with my patients, I've gone through the contraception, menstrual problems, having children, postnatal, the problems around that, and then hit my 40s, and my patients had got to that age with me and were presenting with perimenopausal, menopausal symptoms. My friends were asking me. I started to notice symptoms in myself, and I think when you have, personal experience of something, then I developed my interest from there, and now I can't get enough of it. My husband and kids are sick of me talking about it. Everything on Instagram, all the podcasts when I'm walking the dog. Yeah, everything menopause.
Yeah,
I think it's fascinating because it just affects it obviously affects half the population, doesn't it, at some point? But so many different ways that it can manifest itself and affect people's well-being.
Absolutely. And it's that whole conundrum of joining the dots. When I'm in industry, I do lots of webinars about menopause, perimenopause transition, and talk about connecting the dots. And there's some amazing statistics that it can take a woman on average 12 months to connect possibly the 8 symptoms that she's been living with for 12 months. So, we've got to do better, haven't we, to help women understand, not to brush it off as getting older and a bit of joint pain and, I've got another bout of candida thrush infection. It's about being able to have a supportive service that you can go to and that people assist you with that, which is so lovely. And I love your values as well. I'm a values girl. Anyone watching this from the executive coaching arm will know that I always talk to people about their values, and your values are brilliant. They're approachability, compassion, evidence-based, and collaboration. Tell me a little bit about those. Why those are so important?
We actually spent quite a bit of time on that, actually. And I've had coaching in the past, and I think one of the things which which you will do in your work, is trying to align your personal values with what you bring to work. So Fiona and I both filled in a long sheet, and that was the kind of there was a, we get on very well. There was a lot of comparison, but yeah, those were the overlap, and those were the things that we thought, if we were going to go to a clinic, that's what we want. We don't want to be fobbed off. We want what's going to work. We want to know, if that person can't help us, where can I go? And that kind of warm feeling where you don't feel that you don't belong there, or you're a bit nervous to go in, because everyone gets nervous, don't they, when they're being vulnerable, when they're sharing things with you or with me. When I go to the doctor, you have that anxiety that I don't think you can get rid of totally, but it's trying to make it as easy for people to really tell it as it is, with the time to do that.
Yeah, it's so refreshing to hear a GP saying about vulnerability, and actually how, it affects you as much as it affects anyone else. I think that's the thing. If we can demystify it, we're all humans, aren't we, at the end of the day? And really, we know you're there to want to do the best by your patients, aren't you? Ultimately, that's what you're doing. So that's fantastic. So let's get into a little bit about menopause and the topic that we wanted to discuss today, which is menopause and mental health. I mean, from your experience, Anne, how do those two things go together? What do you see, obviously, within your clinic, the manifestation of mental health issues and the menopause transition?
Yeah, so I think they can give rise to so many different symptoms for women, and some of them can be really insidious, can't they? I think sometimes the lack of confidence, imposter syndrome, lack of confidence to do things that you might have always done, like driving, struggling with work, presentations. I think the insomnia can have a big impact on how people cope day to day, because the lack of sleep can really affect their functioning and their well-being. Stress, mood changes. I think the irritability as well is a really common one that women describe to me. And going from, and this was me as well, but I've had so many patients describe that they were always quite chilled and calm and kind of rolled with it, and suddenly they're going 0 to 60 and shouting at the kids, shouting at the husband, losing their cool. So I think that's a really common thing, and that I think it's trying to tease out these things in the consultation, because that may not be something where you think to go to your doctor. But I think if someone says that to me, that they're going from 0 to 60, then I'm thinking hormones. So I think, raising awareness of those types of symptoms, reduced in, sometimes you can get into a vicious cycle as well, and I think that's really common, where you are feeling anxious, so you become a little bit more withdrawn. You don't socialize so much, you disconnect from people. That then leads to an increased anxiety, because we know that connection is really important for mental health, and you can get in a bit of a vicious cycle with some of these symptoms.
Yeah, absolutely. And those are all the things. I mean, when we think about in business, where mental health is being talked about already, menopause is a little bit behind, but there's that commonality between both of those topics, isn't there? That we know that the anxiety, and we know stress. I mean, that's something we talk about a lot in the work that we do, which is actually, if you've got a lot of cortisol bouncing around your system, that is going to affect your sex hormones. There's no doubt about it. Evolutionary wise, we're not designed to be reproducing and running away from a saber-toothed tiger at the same time. So it is the thing that can be the biggest indicator. And a lot of people, one of the things I'm keen to say is that actually you can take HRT, but unless you have a handle on some of those things that are causing you additional stress in your life, the HRT can only do so much. So it's really important, what we consume on inside here is what actually ends up manifesting. So you're absolutely right. And so for anyone watching this, it is about maybe just connecting those dots, like Sam said, about that anxiety, the sleep. And how does, when you think about the range of sleep issues that do present, I mean, is there more than one? Is it more than just insomnia? I mean, what other things do you see in your clinics?
Yeah, so I think the commonest is being able to get off to sleep, but then waking at 3 or 4, and then that's the worst time, isn't it, to wake up, because you've not got that much longer. I think then people start to panic, but that waking time and not being able to get back to sleep is probably the commonest. But I think also, I think you're completely right that people don't, HRT isn't the sticking plaster for everything. So I think we need to take a really holistic approach to how people manage their stress, because the other thing that can happen is they're lying awake at night and going through everything that's happened in the day, everything they have to do the next day, you know, focusing in the past, focusing in the future, ruminating, catastrophizing. So yeah, I think the sleep problems can definitely be caused by hormonal decline, but also time of life and the different pressures I think women are facing at this time. So learning how to reduce that cortisol level and manage your stress, and have the ability to self-care in your week and prioritize those things is really important.
Definitely. And I mean, when you see your clients coming to see you, I mean, what's the starting point that, you know, because it's a limited time in a consultation, isn't it? I mean, do you have any advice for women in terms of how they can best prepare so that they feel they can absolutely get the most out of a session? Because that in itself would dial down some of the stress and anxiety, wouldn't it? What would be your advice to women coming for an appointment about their menopause?
Yeah, no, that's a really good question. And I think I have two hats on. So I have the patients coming to me privately that have 45 minutes, an hour, and then lots of follow-up after that. But I work as an NHS GP and have 10 minutes. And that, you know, I can never do a menopause consultation in 10 minutes. It can be helpful sometimes if women have tracked their symptoms and they have identified that this may be caused by perimenopause or hormones, which I think is happening more often now than it maybe was 5 years ago, where people come and say, I think I am perimenopausal and I've got all of these symptoms, and then we can go through the consultation and come up with a plan. I think the more difficult is where women have not thought that the symptoms could be hormones, and so they're coming with maybe palpitations or insomnia or joint pains, or what's been put down to long COVID, fibromyalgia, and you have to kind of pivot the consultation onto, I think we've excluded all of those things, this could be your hormones, and then starting, you know, sometimes women are completely taken aback if they're in their 40s and they're not expecting that conversation. So that can take time over a few conversations. But I think the tips for a NHS GP appointment would be try and prepare for it. Try and track your symptoms with a symptom tracker, the Balance app or something similar. Identify who the doctor is at your practice who's good at women's health, and that may be asking reception or seeing the practice nurse. That may be, you know, the best person to see. Ask for a longer appointment if you feel you need it. If there's a lot of things going on, that's better to have longer and come up with a good plan rather than feel that you're rushed or the doctor feels rushed.
Absolutely.
Yeah.
And I mean, can you tell outwardly from someone coming in how their mental health is? I mean, because mental health is largely invisible, isn't it? I mean, can you tell when someone walks through your door, Sam, actually someone here could be really struggling? What would you notice about somebody?
Good questions. I think I'm able to pick that up, but it's much better now we're doing more face-to-face. I think this is one thing where during COVID times and things have moved onto the phone, you lose that connection with people, you lose that body language. I think the, you know, lack of eye contact, you know, appearing disinterested or not really engaged with their own health or the plan, you know, they might be tearful when they're in front of you and you're a foot away, whereas on the phone you may not have picked up that they were emotional. And often it's it's not the thing that they come in with. So I think it's trying to give people the opportunity to tell what's really important to them. They may come in with a fungal nail infection, but you know, there's lots of other things going on.
Yeah, I think that's so true. I can remember when I went myself, you know, I travelled some distance to get, and I went for my private appointment, and I just it was quite stressful getting there because it was loaded with expectation, you know, thinking I hope someone's going to be able to help me. And then I just had this overwhelming feeling that I needed to tell my whole story. So like you say, you know, you're not going to be able to do that in a 10-minute consultation. And it's that feeling of, I just need someone to hear. I need someone to understand what it's like for me, because no menopause experience is the same, you know, across people. You know, it's as unique as your fingerprint, really, isn't it? And so it is that. But I think it's really important, even as partners watching this, is it's to be aware of, you know, if your nearest and dearest do seem a bit disengaged, you know, a bit detached, you know, not really enjoying life, you know, it's really, really important. And I guess, you know, I always think something that would be really helpful is for, you know, partners to come along to menopause appointments, because we do have a problem trying to get partners, particularly men, to engage with menopause. I mean, do you have a viewpoint on that, you know, in the context of how we help people to manage this situation? I mean, how do we get more men engaged?
Do we? It's really difficult, isn't it? Because I think men are not as engaged with their own health. And definitely we see far less men than women in their midlife. So I think it's raising awareness about men's health, probably, you know, as well as what can happen to their partners. I think the conversation that's happening around menopause, and, you know, I was on the phone earlier to a company that are providing menopause training to the women and men at their company. So I think normalizing those conversations helps, doesn't it? If they log onto a talk at work and everyone's talking about it, that will be helpful. And I think men going along to those appointments is a good idea. They often have a different perspective, don't they, on things that are going on at home.
Yeah, my husband came to me with all of my appointments, and he didn't have to be dragged there, by the way. There was no incentive. He wanted to come because, you know, he was the person who has been supporting me, and through the really difficult times, you know, the rage, the inconsolable crying, you know, all of it, and in between. And I did just see something, actually. I've just had my copy of the Menopause Society journal, and really I think there was a council that have implemented some menopause awareness, and what they've actually seen is the biggest barrier to menopause awareness actually having a positive effect is ageism, actually, within organizations. So, you know, what do you think about a menopause woman in 2022 compared to a menopause woman, say, 20 years ago? What are the differences now, do you think? In terms of how women, you know, present with menopause? What would you say your experience is?
I think life expectancy is longer, isn't it? We're going to spend a third of our life in menopause, and I think rightly we want to live and feel well in our mental and physical health, and it's right to have that expectation. I think maybe in our parents' generation, people were not, you know, I don't think they were talking to their friends about it. I don't think they felt that they could go to their doctor about it. I think they thought it was a point in time where their period stopped and then they were done. And all of those symptoms, you know, numerous symptoms that can be put down to menopause, I think probably weren't dealt with, ignored. If they did go to their doctor, maybe that wasn't talked about or discussed. And then we had the scare around HRT, which would coincide with that time. So people were not offered treatment. And I think now you're getting those women in their 60s and 70s who are coming to us and saying, well, actually, I wasn't allowed it then, but I think I would really benefit from it. So I think the difference between 20 years ago and now, I think women are having those conversations with their friends, with their doctors, online. I think me and you are probably in a little bubble where we think that's happening more than it maybe is. It feels like it's happening, doesn't it? But I wonder how much is the reality. I think we're definitely getting there in terms of talking about it much, much more than 20 years ago.
Yeah, I think you're right, Sam, definitely. And, you know, how do you counter this? I have a lot of women, you know, like when you do webinars and chats and things, and they'll say, well, you know, I've got no symptoms, Amantha. I mean, what's your take on that? Should we be having HRT anyway? Because we've got that one end of the scale. At the other end of the scale, I have women saying to me, my GP's told me I can have HRT for 5 years. Which 5 years do I pick? So we've got all of that in between. What's your take? What is your take on HRT? Should we be having it till we go to the grave? Should we be having it whether we have symptoms or not? Do you have a view on that?
I think it's very individual, isn't it? And it's for a conversation with that woman and her doctor based on her symptoms, based on how she's feeling, the impact they're having, other things that she can do in terms of lifestyle, and see. But for most women, the benefits of HRT will outweigh the risks, and to take it in the long run is definitely an option. Yeah, I think the group of women who maybe feel they've got no symptoms at all, so that'd be 25% of women, won't it? 75% have definite symptoms. But I think it's interesting to raise awareness of things like joint pain, tiredness, insomnia, you know, as well as the usual hot flashes, or it might be dryness down below, it might be recurrent UTIs, it might be things that they are not associating with menopause.
Yeah, I think that's a really good point, because actually once you start having that conversation saying, oh, brilliant, so you've got no symptoms whatsoever, they go, well, apart from when I go for walks, actually, yeah, my knees are really creaking. Oh, right, okay, yeah. Oh, and actually, yeah, a lot of hair comes out in the morning in the shower. Oh, okay. So it's almost like that mindset. What do women think menopausal symptoms will be like? And so I think things like the positivity campaign, which is all about putting posters up, raising awareness about what these symptoms are, and there are more than 45 symptoms now, so you know, we really should be helping people to do that. I mean, holistically then, what other things can women turn to? I mean, certainly at your offerings at the clinic, what sort of holistic approaches can women also engage with that are useful for their menopause and their mental health? Can you suggest anything?
So many, aren't there? Seeing someone like you as a coach if they're struggling with work, definitely there's lots of resources online, isn't there? You know, Instagram, Louise Newsom, good websites, Menopause Matters, the positivity campaign. I think the information is there. I think in terms of lifestyle, it's really important to know that in your 40s and 50s, you may not be able to live life as you did in your 20s and 30s, and you need to look after yourself. So you need to prioritize yourself in the week, and make time to exercise. That would be top, wouldn't it? Whatever that is, whether that's walking, you know, I walk the dog and I do yoga. Not great at running. I don't really get much from high intensity exercise, but for someone else that might be brilliant. Doing it with a friend, trying to put it in and trying to get it done. Eating well, getting out for a walk in the park, supplements. Magnesium is, I've got some evidence around sleep, B vitamins, trying to make sure you have enough rest and you try and get in a good sleep routine, connecting with other people, seeing good friends and having conversations, and you know, and seeking help if you're not feeling well in your mental health, because you may or may not be on HRT and you may or may not be menopausal, but I think if you're struggling with anxiety, depression, low mood, then often therapy, CBT, mindfulness can be really helpful.
Yeah, absolutely, because there's statistics, isn't there? Yeah, in a nutshell, all of that, etc. Some 60% of women are misdiagnosed, aren't they? Incorrectly given antidepressants for what are actually menopausal symptoms. And we know that progesterone, which is the hormone that tends to go wobbly first, although we're told a lot about estrogen, it goes wobbly first, that's actually an anti-anxiety hormone. So if that's going a bit chaotic, then it makes sense. But you're absolutely right. I mean, things like that, self-care, we're terrible women at prioritizing ourselves. We put ourselves last after, you know, the children, our partner, the cat, the dog, the guinea pig, and then we might say, actually, time for me. But you're absolutely right. Anything like that, and it doesn't have to be big chunks of time. That's the thing I'd like to just say to people. All the wonderful things that you mentioned, you know, we know that just 10 minutes of mindfulness or meditation can do wonders for your nervous system. Things like belly breathing, you know, just mindfulness when you're having a cup of coffee or a cup of tea, something like that. But there is help out there, and it's about not suffering in silence. I think that's so true what you said, and I really like that connectivity point. I've read a book about strengthening your brain. It said during the pandemic, this just blew my mind, it said that your frontal cortex shrunk by 20% because we're not engaging with people.
We're not engaging,
and it's just so powerful.
I think life shrinks a little bit as you get older anyway, doesn't it? Your friendship circle tends to go a bit smaller. But I think having those really good friends and making an effort to do something outside of work and the children and the to-do list, putting those things in first really is helpful, isn't it? I mean, I know if I try, and also the other thing we didn't talk about is alcohol, but I know
Yes.
if I don't drink and I go to bed and have a good night's sleep because I've not had any alcohol, and then I get up, walk the dog, do a bit of yoga, see a friend, whatever comes at me, and not whatever comes at me, but I feel much more able to cope with the day-to-day stresses than if I have been out, not had enough sleep, not really, kind of wake up in the morning, school run straight into it. Everything's a bit fraught, isn't it? So I think it's trying to slow the pace, take a breath, and yeah.
And you're right, being intentional about it. I mean, I often think a good day starts with what you do the night before, like you say, and I'm the same. I actually had a DNA profile done, and do you know what? It was really helpful to me, in that I was always a party girl in my 20s or 30s. Anyone watching this will just be throwing their head back laughing when they hear me saying that. But I would always be the last to go to bed. And so what I've done, I've interviewed a sleep coach actually for, it's coming out this week because it's Sleep Awareness Month. And actually, you can still stay up late, but as long as you're getting the right amount of sleep, so 7.5 hours, and your wake time is the same. And a game changer for me, I don't know if you've ever tried this, but I actually wake up at the same time 7 days a week. Because that way your body is used to it. We sort of kid ourselves that lying in for a couple of hours is going to help us. And most people will say, no, actually, I feel worse. Or I feel even more sluggish, can't get going. So you are right. I suppose is it everything in moderation, possibly?
Everything in moderation, yes.
That's what the Bronte sisters would say.
Yeah, exactly. But I think sometimes people do self-medicate with alcohol, don't they, if they're having a bad day, and then have too much to drink, and then it has a knock-on effect on their mental health the next day and their sleep. I think unfortunately, because I, like you, was probably the last person to leave in my 20s, 30s, but now I weigh up. Is it worth it the next day? Sometimes it's
maybe
not.
That's maturity. Do you think that's our maturity?
See, there's so many good things about the midlife. It's not all doom and gloom.
No,
maturity, wise decisions.
Yes. And so let's talk about the positive things, because actually menopause does tend to be one of those, it fades to grey, doesn't it, type conversations where we sort of think, well, it's not that great. But here you are talking about, setting up the clinic with your really good friend. That's really positive, isn't it? So what can we tell women that is positive about perimenopause, menopause? What can we tell people from our own experience and what we know generally about this time that is worth really fighting for and hanging on to? What's your views?
I think it should be a really great time, shouldn't it? And I don't know about you, Amantha, but am still slightly a bit of a people pleaser. I would say yes. I'd say yes to most things. To most people, to most, I think something that comes in midlife is the ability to say no, which is a small sentence, but it makes a big difference, doesn't it? If you feel and you don't have too many second thoughts about that, I think saying no to things is something that is a positive. And I think it's a time of reflection, isn't it? You look back at what you've done, where you want to be, and what you want to do. And I think part of setting up the clinic was a real passion of mine, and it's a long time till I retire, and I love my work, but it was trying to do what I love. And I think a lot of women have that change in career, or think about their values and what's important to them, and try and shift to more reflect what they want to do. And I think slowing down a little bit, rather than the boom and bust that you might have had in your 20s and 30s that we probably both had. I think slowing the pace and being a little bit more mindful, I think enjoying the little things, like a cup of coffee and a dog walk. I'm good.
Exactly. I love that. I think that's so important. And I always say to the people that I coach that, menopause has a tendency to spotlight what was already there. So if we had imposter syndrome, if we had self-doubt, if we lack direction in our lives, I think menopause just heightens that, your awareness around that. And so actually it can be a great time to do the work on yourself. That can be a great positive thing. But actually there's more power in you than you'll ever realize. And this is a time of, this too shall pass. That's the thing. And you've got another third of your life, as you said, to be living, and on average we go to we're 83 and maybe beyond that. So there's a lot of great stuff ahead. And I think women are very good at supporting one another, and I think you said this before, if you surround yourself with those supportive people, equally, if there are people in your group that maybe are bringing you down, limit how much time you're spending with them. Spend your time. I often say to people, think of yourself a bit like a PLC company. Don't give all your shares away to people too readily. Keep something back for you. So you're like the dog walk. But saying no and being confident about why you're saying no without having to justify it, I think it's really lovely thing. So I could talk to you forever, but we've got to get on and work with people. That's the other thing we've got to do.
You know what? One more thing though, I think, is that you have gone through a lot by this time, haven't you? You've met a lot of people in your work life, your personal life. You can see your kind of kids going through the kind of teenage years. You go, well, I know what, not that they will take advice, but you kind of know how to handle all those situations. If they would let me give them advice, I could give them good advice.
Could I just give you some good advice right now? I think we're very wise at this point. And
not always, but sometimes.
And you're so right though, because culturally, we look all around the world, and menopause is a universal experience, but actually our social attitudes towards it is quite different where you find yourself on the planet.
No, that's really interesting, isn't it?
It really is. My mum's Sri Lankan, and so in Asian culture, South Asian culture, the head of the family will always be grandma. It doesn't matter how many men are in the family, the matriarch is ultimately the most important person, and really revered for her wisdom. Even apparently I read this quite recently, in killer whales, in orcas, orcas revere the eldest female in the pod. She will always lead the pod. Why? Because she knows how to navigate around the dangerous seas and the open water, and actually she will keep the pod safe.
Amazing.
Which I think is lovely, So I think maybe we need to do more, and maybe let's hope that this awareness phase for menopause isn't a fleeting thing, that it's here to stay, and a wider topic of women's health generally, because I think you described that brilliantly, the whole life course of women from puberty to death. Basically, it's all about managing our hormones. So tell me, what do you hope for women in the future, Sam, when you think about all the wonderful women that you're working with and treating? What is your hope around menopause and mental health?
I think it is that they have the confidence, because there are amazing women that you and I both meet in our work, seeing them as clients or patients, in our friends, in our family, and I think if women can get help for things they're struggling with, I think a really important thing is being able to be vulnerable so that you can share those difficulties with friends, but also with your doctor, and people who could help you through. Because I think once you acknowledge the difficulties, then you can move forward with them. So I think being able to talk, and I think we are getting so much better at that, both in menopause and mental health, which are my two big passions in medicine. I think we're getting better at going, this is a phase, isn't it? This is something that in menopause, half the population will go through, 25% of people will have a depressive episode. And I always say that if I see people with mental health problems, this is something I'll see every clinic, but not everybody is talking about it outside of it. So I think being able to talk probably is the thing that will come, and is much better, I think, than it was.
And if you could give, that's brilliant, could you give some advice for the person listening? How do we create an environment for a person to talk openly? What would be your advice? Because you are obviously expert at this. What advice can you impart to someone like myself about how do we be better listeners? How do we be the space for someone who's struggling?
How do you listen?
How do I listen?
No, are you asking me how?
Yes. So for someone who's maybe sat listening, watching this, thinking, well, I think so and so is struggling, what do I do now? What would you suggest?
So I think it's identifying the good people in your circle, isn't it? The people that you would be there for, who you feel would be supportive and have been through maybe something similar. So I think speaking to friends about how you're feeling, or a colleague, I think definitely trying to access support from your doctor or someone else at the practice, or privately, or talking to a therapist if the problems you feel are mental health. So I think trying to get a plan. And so often if I see a patient who's really, and I always say it takes a lot of courage actually to make that first step. So if they've picked up the phone, they've made the appointment, they've come to the appointment, that's more than half the battle of getting better, is getting to that point. Because then there's so much you can do. If you are acknowledging that you're not feeling yourself in terms of your mental health or menopause, but if you're not feeling well and you come and share that with someone, then there's so much that we can offer.
Yeah.
And
how do you listen? What makes you a good listener? What do you need to do and what do you not need to do to be a good listener, in your opinion?
You need to give people time to talk uninterrupted. And then I tend to ask very open questions. It's difficult in 10 minutes to, there's a difference between an hour and 10 minutes. But I think in both situations, professionally giving people time to tell their story, and also asking about the impact of that, because what is important to me as a doctor in terms of what's your risk factors, do you smoke alcohol, their main priority might be how it's affecting their relationship with their husband, or they're just about to give up work. And I think understanding where they're coming from, what their main concerns are and what they want to do, it's a fascinating and it's amazingly privileged position when people share those things with you. I hope I do it well. I think you can always probably listen better, can't you?
Yeah, I think it's always that temptation of desperately wanting to help and wanting to say, well, you could do this or you could do that. But actually, you're so right. And I think that's how I felt, that actually I just need someone to listen and I just need to tell you everything. So then I feel like that's my part. That's my part done. I haven't left any stone unturned, because this is the only, and especially with waiting lists and things like that, I think people feel that urgency to, well, I've got to tell you everything because this is the only appointment I can get for 6 months with you. It's that sort of thing. But I think that's so important. I didn't know I was going to ask you that question, but I'm so glad I did, because listening is a skill in itself. It really, really is. And you learn so much more when you're listening. Active listening. So, as we bring our interview to a close, thank you so much for giving me your time.
No, thank you. We could chat all day.
I know, and maybe we do some more. It would be lovely to talk to you. So tell people, Sam, how they can be in touch with you, your work, and everything that you do, because I so recommend they do. How can they get in touch with you?
So the website is www.thebronteclinic.com. Instagram is the Bronte Clinic. And I am Menopause London GP on Instagram as well. The phone number and emails are on the website. Inquiries at thebronteclinic.com.
Okay, absolutely. And I'll put all of those details on the show notes. But I think what you'll have seen watching this is you living your values completely. Approachability, compassion, evidence-based and collaboration. You actually exude that and so much more. And so thank you so much for giving us your time. It's been invaluable. And please get in touch with Sam if you feel that direction would be useful to you. So from me to you, thank you so much for today.
Thank you. Have a lovely day.
And you.